Good afternoon. Welcome to the EMA office here for day 301, where we bring you the latest numbers on the COVID. Joined here with Chairman Mark Kern and Sam Behrman from the Health Department. Sam, you have our numbers today and a lot of information.
Yes, lots of information. So as of today, 219,844 St. Clair County residents have been tested, which is an increase of 2,025 from yesterday. And we are at 22,713 positive test results, which is an increase of 330 from yesterday. And that does include both males and females from under the age of 1 up to their 100s. Today, our daily county positivity rate is 16.3%, and we are at 197,131 negative test results. We are reporting one new additional death today, which does bring our total for St. Clair County to 352. That was a female in her 80s who had unknown health conditions, and as always, our sympathies go out to her family. For those who have completed the IDPH required 10-day isolation period, we are at 20,097. For state totals, 13,922,611 have been tested, with 1,017,322 positive test results, and that's an increase of 9,277 from yesterday. And for deaths, the state is reporting 17,395, which is an increase of 126 from yesterday. For hospitalization numbers in St. Clair County, currently we have 108 patients that are admitted due to COVID-related reasons, and 13 of them are on ventilators. Regionally, we have 200 patients that are admitted due to COVID-related reasons, and 17 of them are on ventilators. For our congregate living facilities that are currently or previously been in outbreak status, these are cumulative numbers, and we will only announce any facilities that have had changes. Cedar Trails in Freeburg has 17 cases and 1 death, and that is an increase of 3 cases for that facility. Colonnade Senior Living in O'Fallon has 64 cases and 2 deaths. That is an increase of 45 cases for that facility. Freeburg Care Center has 120 cases and 4 deaths, and that is an increase of 1 case. Joe's Place in Shiloh has 7 cases and no deaths, and that is an increase of 5 cases for that facility. Knollwood Retirement Center in Caseyville has 13 cases and 1 death, and that is an increase of 1 case for that facility. Mercy Rehab and Care Center in Swansea has 125 cases and 14 deaths. That is an increase of 1 case and 1 death for that facility. Morningside of Shiloh has 21 cases and 2 deaths, and that is an increase of 2 cases for that facility. And finally, Sycamore Village in Swansea has 28 cases and 1 death, and that is an increase of 4 cases for that facility. Before I turn it over to Chairman Kern, I'm sure a lot of you have seen the video that the EMA Facebook page put out earlier this afternoon, as well as you may have received the code red. We are happy to announce that on the Health Department website, as well as the Facebook pages for both the Health Department and EMA, we have a link. If you go to co.st-clair, CLAIR.il.us, you will see the page that has been brought up. The red line across the top where it says visit the COVID-19 page, you're going to click on the blue link that says visit the COVID-19 page. And on the top right, you will see where it says vaccine notification sign up. You're going to want to click that link. Before you click the link for the survey, you will see the items that you need to have before you get started for the link. This is the information you will need. You will need your name, your date of birth, your age, address, phone number, email address, and these are all required fields. So you must fill something in, so it's best to have that information before you even start. When you're ready, if you see where it says click below to be directed to the form, you're simply going to click on that link, and it will guide you through the survey. Before we get any further, I want everyone to be very clear, this is not registration. Not registration for the vaccine. This is simply so we have your information, we know what category you fall into, so when we are ready to open up those next phases, we have the contact information that we can blast all the specifics out to you. So as you scroll through, you'll be able to see the different questions. Obviously, you have first name, last name, address, city, state, zip code, your health department jurisdiction, so St. Clair County, Eastside Health Department, or if you don't know what county you live in, you can check that box as well. Your phone number with area code. Again, an email address is required. Your date of birth. If you are a healthcare worker, if you are not sure if you fall into that category, there is the description as IDPH has listed it to help you decide if you fall into that category or not. That is a yes/no question. And if you are a frontline worker in the essential worker category, there are the options that are given by Illinois Department of Public Health as well. If you don't find yourself in any of those categories, you can click the other button and it will allow you to type in an option there. Following a little further down, if you are in the other essential worker category, there are some listed that as defined by IDPH, and you can check multiple if multiple apply to you. And again, in that case, you can click other and type something in if you don't fall into one of those categories. The last one is if you have any health conditions that are currently going on with you. In this one category, you can also pick multiple that apply as well. And can you scroll back up for just a second, Randy? As you can see, always consult your physician to find out if the vaccine is recommended for you based on your personal health care needs. And then at the very bottom, you will simply click submit, and that will be generated to the health department. This information is kept only at the health department. And as I said, this is going to be how we are going to flush that information out when we move to the next tier, and we will use this information to know who to send it out to. So we're super excited about it. But right before we came on, I believe we had over 6,600 people that had already filled it out, which is great. This is a great way for our residents to get us the information we need, so when the vaccine is ready for you, we'll be able to push it out.
So right now, they're vaccinating healthcare workers, hospital
Yes.
workers. The next phase that comes will then, people who have checked the right box, or the box, they will then be notified, hey, you're over 65, or you fall in this category, the vaccine is now available to you. Please make your reservation at that point.
And then this is how you can register for that vaccine.
Right. So this mainly is a notification portal, and that's what people will be in. And I think almost 7,000 people by now are in it.
Yeah,
the health department's rolling.
It is, and I will tell you, our phones are on a roll too. So if anybody has any questions, as I said, it's listed on both Facebook pages for EMA as well as the health department, and on the health department website itself. So we are very excited to have it up and
Sam,
running.
just kudos to you and the health department over there. The response today with our Team St. Clair, people on there saying they've already filled it out. It's good. They appreciate it. The extra phone call from Code Red. So it's being received real good by the public, and that's what we want. Like you said, almost 7,000 people in a short amount of time. And this is going to help speed that process up.
It is.
Logistically.
It is. And if you have an elderly family member or an elderly neighbor who might not be so tech savvy or doesn't do the internet, you can get their information and submit it for them. So we ask that you only submit one form per person, but if you know someone who doesn't have internet access or isn't the best with technology, you can certainly help them out and submit their information for them.
Very good. Thank
Great,
you.
and that's basically on the St. Clair County website
Yes.
also.
Yes,
so
it is.
That's what that address is. So if you've been on the St. Clair County website, you'll be used to going on it. If you haven't, there are a lot of other things to look at on there too. So are we ready for zip codes?
We are ready for zip codes.
Okay. We'll move into the zip codes then. In 62201, we're up 6 to 470. 62203, we're up 2 positives today to 525. 62204, also up 2 to 338. 62205, up 1 to 532. 62206, up 15 to 1,063. 62207, up 4 to 487. 62208, up 16 to 1,296. 62220, up 11 to 1,564. 62221 up 30 to 2,179. 62223 up 14 to 1,357. 62225 up 1 to 114. 62226 up 30 to 2,467. 62232 up 19 to 733. 62239 up 9 to 367. 62243 up 8 to 596. 62254 up 9 to 646. 62255 up 4 to 60. 62257 up 2 to 256. 62258 up 8 to 809. 62260 up 13 to 569. 62264 up 8 to 271. 62269 up 32 today to 2,508. 62285 is up 2 to 424, and 62289 up 2 to 43. 330, record day, new positives today, highest day we've seen ever. With 2,025 tested, brings us a daily county positivity of 16.3%, and that's up from yesterday. The 7-day rolling average is down a bit to 15.1%, but still way high and the highest in the state. The regional positivity today remains at 13.5%. Bond County clocks in at 36% today. Clinton County at 7.9%. Madison County at 17.5%. Monroe at 17.4%. Randolph, 12.7%, St. Clair County at 9%, and Washington County at 29.9%. Way more people under 50 than over 50 years of age that have contracted COVID today, as in most days now, Herb. I think that is becoming the normal, that this virus is affecting younger people, even in a far more greater fashion than older individuals.
155 under the age of 40 is just, we talk about every day. That's a number that we watch, and, the daily county positivity rate up to 16.3 from 14.2, definitely heading in the wrong direction. And, it's, as we keep talking about this 301 days, we're still doing the testing, and now we're gearing up for the vaccine. Logistically, it's a nightmare, as we all know, and we know it's a nightmare for you, Team St. Clair, but believe me, we're working daily to try to make it as easy as possible. We need the vaccine, more of it to get here to where we can start getting into the arms of everybody.
And that's going to take time.
It takes time.
Even as we get more and more vaccine and we start to actually have enough vaccine for all the entities to be vaccinating, this is a lengthy process to be able to get to. There are 60,000 people in St. Clair County that are 65 years and older. And that's the category that we will be getting to in 1B. That's where a lot of Team St. Clair, a lot of our watchers are in that category. And it's going to be a significant undertaking with all of our partners to be able to vaccinate and get through the 1B population, let alone get through 1A, which I think I heard this morning the governor announced he thought it would be sometime in February until we got through 1A. So this is just going to take time, and because of that, we have to remember that these masks are extremely important. Now while we're waiting to get a shot in our arm, we got to make sure that this spread slows and gets way below the 15.1% rolling average that we see today. Only way to do that is to wear the mask, wash the hands, and watch the social distance. We've got to be able to get there. We're also hearing in the news that perhaps this new strain of virus is getting more and more common, and that the virus is getting easier to catch as it's morphing into something new. So The best way to make sure that we don't have the spread is just to do what we're asking you to do, what I think is your duty to do, to be able to keep our community as safe as possible and get us ready to get our sleeves rolled up and get this vaccine.
Well, you know, another death overnight related to the COVID, up to 352 here in the county. And you talk about the partners, there's just not one entity that can do this. I mean, today you had a meeting with hospital representatives working on the logistic plans of mass vaccination.
And they've been great.
I mean, and that's what it's about. People stepping up to the plate, kind of like all of our Team St. Clair people who follow and share this page. The response we got today when we put out the code red, another part of that toolbox that the county is using to get mass notification out there. The health department, it's a team effort, and you're all part of that Team St. Clair. And yes, it's been tough on all of us. If anybody's out there that says it hasn't been tough on you, I don't know where you're living. Because we're stressed with it every day, but as I've said for 301 days, we may all be tired, we may all be stressed out about it, but the virus is still here. It's still affecting families, it's still taking lives, and it's going to continue to do that until we can get this vaccination in here and everybody get it in their arm. And I'm really happy that the Team St. Clair members that I'm seeing on here that has shared it with their families, their loved ones, people are signing up 7,000, probably up to 8,000 by now, Sam, I think. I know you're keeping track of the ticker there. And that is definitely going to be an asset when we start getting this vaccine out there. You'll see that you'll be getting that notification by your email that you submit, by the code red notification, or by a phone call. We will make sure that everybody's getting notified. So please continue to have patience, and I know you get tired of hearing that old broken record, but you're going to continue to hear it until we get behind this thing here, and we will. We'll be back tomorrow for day 302. We'll be back with Cindy in just a few moments. Before I go, I want to thank our good Team St. Clair member from Marissa that sent the surprise package in today. The staff enjoyed it. We appreciate everything you do, and the fine folks down in the Marissa area. We got a testing site coming up down there, I think, later this month. So we really do appreciate that. So we'll be back with Cindy in just a few moments to translate this into our Spanish communities, and we'll be back tomorrow for day 302. Have a good evening.
I have battled this virus both professionally and personally. Professionally, I can tell you firsthand that it's greatly impacted our community, caused the loss of many lives, and continues to spread today. Personally, I can tell you that I contracted COVID-19, and it definitely is not the flu. This virus affects everyone differently, however, many have severe consequences. Please take this time to help your friends, your family, your neighbors, and the entire region by wearing a mask, washing your hands, and watching your distance. Together, we will overcome this invisible enemy.